Hi, I'm Sonia with Health Touch Chiropractic. I'm here with Dr. Pleau today, and we want to talk about something that we see here every day, that's headaches. According to the World Health Organization, headaches are among the most common disorders of the nervous system. They're underestimated, undertreated, and underrecognized worldwide. So, Dr. Pleau, can chiropractic care help with headaches?
The short answer is yes. What type of care is appropriate really depends upon what type of headache a person has. There are many different kinds of headaches, and so the treatment obviously depends upon what the problem is. So, like medical physicians, chiropractic physicians understand how to recognize the different types of headaches by asking very specific questions, by doing examination procedures, by ordering laboratory tests and imaging studies such as MRI.
So what are the different types of headaches? What can cause a person's head to hurt?
So when a person has a headache, the first and most important thing to determine is whether or not it is a pathologic headache. So that's going to be something that's life-threatening, such as from a stroke or a brain tumor. In those cases, obviously, the most important thing to do is get that person to an emergency care facility where they can get the life-saving medications and surgeries. Barring that, one of the most common types of headaches that we see is called a post-traumatic headache. We see lots of people who've been involved in motor vehicle accidents, and when the spine is jarred severely, such as from an auto impact, it can damage the little tiny ligaments and muscles at the base of the skull and create inflammation, which can produce a lot of pain in the head. So that's a common type of headache, would be a post-traumatic headache. Another very common headache is called a tension headache. And tension headaches are related to dysfunction in the muscles and the joints in the neck. You can have misalignments or restrictions in motion and spasm in the muscles and trigger points in the muscles, all contributing to headache. That's called a tension headache. Migraines are another very common type of headache. With a migraine, the pain generator is the blood vessels themselves. That's why it's called a vascular headache.
So I want to understand a little bit more about how chiropractic helps treat headaches, say with tension headaches.
So with tension headaches, the chiropractic adjustment is an important piece because you have to normalize the function of the joints. You have to get everything working right and communicating well with the brain. Massage is also very important in addressing tension headaches because it can improve the function of the muscles and get the circulation through the area better and reduce the trigger points. Other physical therapy modalities such as electrotherapy and ultrasound can be really helpful with tension headaches. And self-care exercises, corrective exercises can also be really helpful in terms of getting lasting results in resolving tension headaches.
Great. How about migraines?
Migraines are a vascular headache, so the intervention is a little bit more complicated. Sometimes you can use hydrotherapy, such as an ice pack on the base of the skull, coupled with a hot water bath for the hands and feet. That can help calm down the inflammation and engorgement of the blood vessels and can calm down the symptoms a lot. Other things that can improve migraines would be addressing food sensitivities. So there may be a certain food that a person's eating that's causing inflammation and driving a migraine. That can be a piece of the puzzle. Their detoxification can be part of it. If their liver's not doing a good job of pulling toxins out of the body, that can be contributing. Hormonal imbalances can definitely be contributing with migraines. Other metabolic disturbances in the cell energy pathways or nutrient deficiencies. Magnesium deficiency is a common one linked to migraine. So with migraine, the causes are multifactorial, so the interventions also need to address all those different factors. Yeah.
How about menstrual headaches?
Menstrual headaches are another very common one. Obviously, they're related to hormone functions. So with menstrual headaches, it usually will start with laboratory testing to really look at what is the balance of the hormones, which hormones are present in excess and which hormones are depleted, and then using natural substances to help improve the production of the hormones that are too low and to help the body metabolize and excrete the hormones that are present in excess. So really what we're doing is we're working towards bringing that whole system into balance. Yeah.
Okay. Awesome. How can people learn more about this?
So you can learn more by going to the website, www.healthtouch.info, or you can call the office, 503-941-9912, and schedule a consultation.
Great. Thank you, Dr. Pleau. Thank you for your time. We hope you have enjoyed this conversation about headaches.